Hi, Chris 𝗲𝗏 here with some interesting information on how you can stop those calls, either the robocalls or just people saying that they're with Medicare or they just want to help you with Medicare. Stop the insanity. I'm going to give you some tools today. Finally, you can take control of those calls, and also some new things happening with Medicare, specifically Medicare Advantage, some changes that you definitely want to be aware of as you make your choice for which type of plan you'll have for the next year. If you're not familiar, my name is Christopher Westfall. We've had over 8.5 million views on YouTube, just educating people on what happens with Medicare. And today I'm going to give you some tools as to how you can stop those crazy calls of Medicare folks. What it is, how are you going to stop these people from calling you all the time? It's horrible. Well, they're taking new enforcement action with the do not call list. If you've not yet registered for the do not call list, you need to absolutely do so. You can take your handy dandy phone out right now and put it up to this. Take a picture on your camera of this on the screen right now, and it will allow you to go to this page where you can sign up for the do not call list. Don't worry if you can't do this right now. The links for everything I'm going to mention, all the tools, are going to be available in the video's description, so you can look at it at your own leisure. And if I talk too fast, you can even slow this down and go back and play it again. The do not call list is where you should register every phone that you have. 31 days after you have registered your phone, it is then illegal for people to cold call you. And yes, that includes people calling you about Medicare. Unless they enjoy an existing business relationship with you, they're not allowed to call you and sell you anything. Home warranties, car warranties, college loan programs, anything at all, if you're registered with the do not call list. So that's the first step to go. Now, what if you're on the do not call list, or you still have people calling you and they say that they're with Medicare? They say that they're with Medicare because they're trying to lower your guard so you will actually buy a policy from them. This is a resource. Again, you can scan this and go to the page and save it, or you can type in the actual address, save it for later, or it's in the video description below. This is specifically getting the Federal Trade Commission involved in those people claiming to be from Medicare. This is not only a marketing violation, it is against the law to impersonate Medicare. I'm going to now show you a little demo of what you do when you get to this page. You'll go to this thing right now to report your fraud, and you'll put it under health. You click on the health category, then you'll see a subcategory called someone pretending to work for, like, Medicare. And then, to the best of your ability, put in the description of what happened. Did you ask the caller for their name? Did you ask the caller what region they're from? A really good thing is a callback number in case you get disconnected, because your phone sometimes hangs up on people. Get their callback number and put that information in the report to the Federal Trade Commission. That's a good one. The caller ID that they're calling from is very often spoofed, which means it's fake, and they're using someone else's caller ID. But go ahead and put that in there anyway, and hopefully they can tie them to somebody else. If more and more people will report this fraud taking place, then we can finally get something to happen. It does happen when enough people are getting involved. So again, if you've not yet made a note of this, please write this down if you're getting a whole bunch of calls about people saying that they're with Medicare or they're marketing to you, and they should not be. On that note, there are marketing rules out there from the federal government, the Center for Medicare and Medicaid Services, that specifically target insurance agents. They tell us what we can do and what we can't do. And there are a lot of laws talking about specifically Medicare Advantage marketing. That's where all the agents are making their money these days, is pushing Medicare Advantage plans. If you get one of these calls from someone you don't know, or you get a violation happening, and I'm going to show you some of those right now, the violations that people are doing, then you need to report them to at least the Senior Medicare Patrol. Other places you can report them are to Medicare directly, medicare.gov, report fraud, and to your state Department of Insurance. These agents need to have consequences for what they're doing that violates the marketing rules with regard to Medicare Advantage. Now, with Medicare supplements, sadly, there are no marketing rules, as long as you're not defrauding people and lying to them. Medicare Advantage, however, is very strictly monitored by the government. We have to get a permission slip, known as a scope of appointment form, before we can conduct an interview with you about Medicare Advantage. You have to reach out to us first, which I'm glad to say everyone that reaches out to my agency calls us on the phone or fills out a form online. We don't do any outbound marketing whatsoever. It's all organic from just educating folks. Let me show you some examples of what agents are doing. 6 examples. I'll just show you 4 because the other 2 are very rare. If someone comes to your house or they approach you in public and they want to talk about your Medicare plans, to talk about your Medicare Part D plan or your Medicare Advantage plan, highly illegal. If the broker says that they work for Medicare or Social Security and you don't think that they do, please get as much information as possible. If they try to sell you a whole bunch of things on that Medicare Advantage appointment and you did not agree to that, that's a no-no. Please take down their information and report it. And again, who do you report it to? These folks, the Senior Medicare Patrol. There's their website. And again, if you click this with your phone, just put the photo up there to take a picture of it. Don't take actually a picture, just hover it over that and you'll see the resource and you can get this information and you can get these things to stop. Agents are notorious today, especially those solely focused on Medicare Advantage. Well, man, I've got some Medicare Advantage news for you today. Don't go anywhere. You'll be blown away. Anyway, let's get this to stop. And these resources, again, are available in the description if you missed it below. Just showed you some examples. Now, for those that are not familiar, this will only take less than a minute. Don't go anywhere because I've got a lot of news on Medicare Advantage here. For those that don't know, because no agent ever told you, which I'm not surprised, there are 2 different ways you can go with Medicare. You can either do original Medicare, which is what you paid into your whole entire life, and you can enjoy original Medicare, which means you can go to any doctor, any hospital, anywhere in America that accepts original Medicare, which is most everybody. And if you get a Medicare supplement, that's what we help with, you can then pay the extra amount that original Medicare does not cover. The most important of which is the 20% that Medicare does not cover on everything that's outpatient. Medicare is great. It'll cover the 80%. Go anywhere, have anything done that's medically necessary and approved by Medicare, which is almost everything. But the 20%, what are you going to do for that cost? That's where Medigap plans come in. They fill in that gap. Also, Medicare supplement is another name for that. That's what we can help with. And then you've got the freedom and flexibility to go anywhere. On the other hand, you could join a private plan called a Medicare Advantage plan. It's not Medicare. It's an Advantage plan that gives you dental, vision, drive you to your doctor, give you a pet robot dog, all these extra things to make up for the fact that they very often deny care. I'll show you many examples here. They'll drop their networks in the middle of a plan year. They'll drop their doctor. They'll drop your hospital. They'll make you get prior authorization before you have anything of consequence done. They save money on you. They put that money in their pocket. That's Medicare Advantage. And for those that like visual representation, here's a good one. On the left, ladies and gentlemen, you have original Medicare, where everything that you need is taken care of in one fell swoop. That's why when we sell mostly Medicare supplement plans to people, and we can do both, we don't have claim problems. We don't have network problems. We don't have people saying they didn't accept my plan. My doctor left my plan. What am I going to do? I'm moving out of the service area. I need to find another network. We don't have those problems because there are no networks on original Medicare. Everything's just paid. Super easy. Your doctor says you need an MRI. Your doctor says you need a surgery. Boom, it's taken care of. You don't have to wait, get somebody's permission and get denied. On Medicare Advantage, they make a habit of denying things. I'll show you more and more proof of that. And they'll change your network on you right in the middle of your plan year, and you can't do anything about it. Let's talk about the news in Medicare Advantage. You'll like this. Well, there's another story about one of the Medicare Advantage plans defrauded the government. They say that they took too much money from the government. You can see the story below. They're saying it's only $25 million this time, and then the company's going to ultimately pay it back. That's your tax money, by the way. And most people will say, well, that doesn't really affect me. That's just, the company making more money, more power to them. It's bad. And here's really bad. Medicare Advantage overbills taxpayers by an estimated $140 billion a year, enough to wipe out all Medicare premiums if they were actually paying it for you. And this just goes through, I won't read the entire thing, just says another example of endless greed. And it says, if they were not paying this money to the Medicare Advantage companies in fraud, they could have enough to pay for dental, vision, and hearing for everybody on Medicare. That's amazing. Just stop ripping off the government. This is one hospital system that has kicked out a Medicare Advantage program. And let me just read to you the highlights right down here as it gets dark so you can barely see it. Let me make this larger. This hospital values our patients, community partners, and policyholders. This decision comes after careful consideration of the relationship and its financial implications to our organization. The termination of our contract with this Medicare Advantage company is due to excessive payment denials for necessary care, delays in approvals for treatment, and burdensome administrative requirements, resulting in significant uncompensated patient care. You're going to see a lot of that today. So as a responsible healthcare provider, they're dropping this Medicare Advantage plan. Bye-bye. Now, what happens if you signed up for this plan and you want to go to this hospital? Sorry, you still have to stay in the plan until your contract ends December 31st, but you cannot change your plan merely because they change your hospital and your hospital is not available to you anymore. Here's another one. No deal reached between this hospital and this Medicare Advantage plan. Let me show you what this means to a real person.
Health insurance facing many people right now here in Kentucky. Anna, hello everybody. Good to be back with you here on this Monday night. I'm 𝗏𝗏𝗃. Baptist Health Medical Group is no longer accepting some Humana insurance patients after the two companies were unable to come to an agreement this past Friday. Today, the fallout is leaving some patients with little to no options. WHAS 11's Alex Ďiederer is sharing how one patient is now struggling to find new in-network doctors.
After months of negotiations, Baptist Health and Humana could not reach an agreement on a new contract, leaving patients insured by Humana Medicare Advantage at Baptist frantic and unsure of where to turn to next.
Everybody's lost. And you try and talk to a social worker or a healthcare advocate here in the hospital, and they don't even know.
Amy Derby has been insured through Humana for 13 years. She tells us that she was notified in late August of the negotiation problems between Baptist, Humana, and Medicare, and was told of the possibility of being dropped.
So I just waited and I waited.
Until she received a letter from Baptist printed on September 13th, but delivered September 18th, stating that her doctor was dropping her as a patient because of her Humana Medicare Advantage plan. That change went into effect last Friday, meaning higher costs for medical services.
But now that I'm out of network, I can't get any actual answers on what copays or hospitalizations or procedures are going to be.
Along with all other patients insured through Humana Medicare Advantage or employer-sponsored commercial plans, Derby is now tasked with finding a new general practitioner, cardiologist, and hematologist-oncologist.
I'm just in a tizzy like everybody else.
Derby says she hasn't received any direction or additional resources from Baptist Health or Humana and has even reached out to Norton, but is unable to find an available physician. In a statement sent to WHAS 11, Baptist Health states, quote, "We understand this process has been frustrating for our community, but we will continue to advocate for those we serve." Humana has not returned our requests for comment. In Louisville, Alex.
The lady's going through cancer treatment and she's on Medicare Advantage, and suddenly they pull her oncologist out and the place where she was seeking treatment. First of all, let me tell you the little known secret about Medicare Advantage plan, regardless of which plan it is, and this gets me fired up, I'm sorry. If you're on a Medicare Advantage plan and you're going through cancer treatment, you are facing a very tough road. Not only the prior authorizations, which, by the way, I had a client that would have died had he stayed on his Medicare Advantage plan. Then they found out that he was on a supplement because we put him on one and he got instantly treated for pancreatic cancer. The doctor said it could be his death knell if he stayed on Medicare Advantage and had that plan. Why? Let me explain to you why. On a Medicare Advantage plan, they will now look at their Medicare Advantage plan. If you have one, right? Look at the Advantage plan. Turn it off. Go. See what they cover for chemotherapy. See what they cover for cancer treatment on your Medicare Advantage plan. Look very carefully at the summary of benefits. In network, which is where you should get your best care. In most all plans that I've ever seen, you're responsible for 20% of the cost of that chemotherapy, 20% of the cost of that expensive treatment. Now, if you're going to pay 20% of the cost and they're going to pay 80% of the cost only when there's prior authorization, only when they agree to the entirety of the whole treatment, then what is the deal with your 20%? You might as well have been on original Medicare and paid the 20%, but been able to go to anywhere you want to go, like Mayo Clinic or Cancer Treatment Centers of America, with neither one of them except Medicare Advantage, by the way. So if you want to pay 20%, you might as well be on original Medicare and not limited to a network. So if you're on a Medicare Advantage plan and you don't have cancer insurance, you're wrong. You have to have the ability to treat cancer with your money out of your pocket when you're on a Medicare Advantage plan. It's a little side note, but it could really save your life. Either you get the treatment or you don't. And if you want to get the treatment, you're paying for it out of pocket. And then the agents who sell those plans will say, yeah, but you're covered by your max out of pocket. That's what happened to my grandmother, folks. Last quarter of the year, she's got Medicare Advantage and cancer diagnosis, surgery, then has another surgery the next year. Guess what? If it's after January 1, your maximum out of pocket completely resets and you have to hit that all over again. So if you look at a max out of pocket and you're like, oh, this is fantastic. The most I could ever pay is $6,000, $3,000, $7,000, whatever it is for that year. And it changes every single year as all the benefits do on Medicare Advantage plans. Then you'll have to hit that again if your treatment just happens to coincide with the change of the new calendar year. Watch how this is impacting more people right here.
Dispute could leave patients in Louisville paying more.
Baptist Health is at odds with United Healthcare, the nation's biggest insurer. United is warning its AARP Medicare Advantage members they will lose access to the Baptist Health hospitals and doctors on January 1st. Meanwhile, Humana Medicare Advantage members have not had access to Baptist's network of doctors for nearly 2 weeks in a separate dispute. Medicare Advantage is an option for seniors to get their government-funded health care through insurance companies like Humana and United, but the extra benefits these plans offer come with trade-offs.
Almost every doctor, almost every hospital in the country takes traditional Medicare. But once you enroll in a Medicare Advantage plan, it's entirely different. They are private plans operated by private insurance companies, and for the most part, gigantic insurance companies that are under relentless pressure from Wall Street to make as much money as possible.
Baptist said it would have more info to share on the dispute with United next week. United has not responded to our request for comment.
The situation with, and this is Wendell Porter again, I just want you to see this quote because it's stunning. It shows the disruption that seniors risk when they choose the Advantage plans. He, by the way, worked for 2 Medicare Advantage companies. Quote, people who are considering enrolling in a Medicare Advantage plan need to understand that the doctor who might be listed as being in network today might not be here tomorrow. And the same can be said about hospitals. Hello, it's buyer beware, says Potter, who runs the Center for Health Advocacy. Okay. Potter, the healthcare reform advocate, said one pitfall of Medicare Advantage is that the plans are not required to tell consumers how long they are contracted with various providers. See, their contract could come up in May, June, July, August, September, October, but your Medicare Advantage contract is January 1 to December 31st. And if something changes with their contract, it affects you, doesn't it? If you're relying on the fact that that's going to be your doctor and your hospital. Quote, there's a whole lot that these companies consider proprietary. That's when their contract's over. That they absolutely will not disclose even to the federal government, which is outrageous. And you just simply don't know. I've got some more for you. Stick around. If you've not yet done so, please subscribe to this channel. A lot of people get the information that they need, they make a decision, and they move on. I appreciate their views, but if you'll subscribe and turn on your notification bell, then when things might affect you or someone you love that's on Medicare or will be on Medicare at some point, then you can be notified and possibly be the hero for sharing that information. So please like this video with a big old thumbs up. Really appreciate it. This is a consumer advocate reporter who wrote this very, very interesting opinion piece that you should know because he did the research behind it. If you don't know that, this is not my opinion, by the way, somebody brand new to the stage. If you don't know Medicare Advantage is a scam, you're not paying attention. We're on the edge of open enrollment period for Medicare, and the Advantage scammers will be carpet bombing America with advertisements over the next few months. Don't be fooled about what it is and who is profiting. Real Medicare, remember the difference between this and real Medicare. Real Medicare pays bills when they're presented. They just pay the bills. Real Medicare. Advantage insurance companies, on the other hand, get a fixed dollar amount for every year for each of the people enrolled in their programs, regardless of how much they spend on the consumer. As a result, Advantage programs make the greatest profits for their CEOs and shareholders when they actively refuse to pay for care, something that happens frequently. It's a safe bet that nearly 100% of the people who sign up for Advantage programs don't know this unless they subscribe to our channel. and they don't have any idea how badly screwed they could be if they get seriously ill. Not only that, when people do figure out that they've been duped and try to get back on real Medicare, the same insurance companies, it's actually different. There's a different supplement side of the house versus Advantage side of the house. They have to have two different tax ID numbers. Don't know if you knew that. They have to be separate. The same insurance companies will punish them by refusing to write Medigap plans that fill in the 20% hole in real Medicare. They can't do that when you first sign up when you're turning 65. But if you leave real Medicare for privatized Advantage, it can be damn hard to get back on it. Now, it's not hard to get back on original Medicare. It's hard to get a supplement if you've already been diagnosed with something. Luckily for you, there are independent brokers out there. I wonder if I know of any of them. Oh, yeah, I know of us. And we can help you look at the underwriting criteria for the various companies and see what company might match what you need to help you get the care that you need. Because we don't represent one insurance company, we represent a lot of insurance companies, and their underwriting criteria is different. But these are not insurance companies punishing you. That's the way the law is written. After you're outside of your initial election period with Medicare, that first 6 months brand new to Medicare, they are allowed to underwrite you, except in just a couple of states like New York. And in those states where the consumers have said, look, we don't want any underwriting. Let us get any Medicare supplement plan we want without any underwriting. So they passed that law. And guess what? The rates for Medicare Advantage in New York are triple what they are in South Carolina, South Dakota, Nebraska, anywhere else in the country. Why? Because the underwriting keeps the rate low by the Medicare supplement companies being able to choose who they accept. That's why you need a broker working on your behalf to get you approved for one if you want one. Shocking report for the ripoffs. Yeah. With real Medicare and a Medigap plan, again, what we help with, you talk with your physician or hospital and you decide on your treatment. They bill Medicare and you never see or hear about the bill. That's a fact. That's why the customer service with Medicare supplement is so dang easy, because they just pay the bills. Go anywhere you want to. There's nobody between you and your physician or hospital, and Medicare only goes after that payment they've made if they sniff out a fraud. With Medicare Advantage, on the other hand, which is not Medicare, by the way, it's Advantage, on the other hand, your insurance company gets a lump sum payment from Medicare every year and keeps the difference between what they get and what they pay out. They then insert themselves between you and your doctor or hospital to avoid paying whatever they can. Whatever you decide on regarding treatment, many Advantage insurance companies will regularly second guess and do everything they can to intimidate you into paying yourself out of pocket. Often they simply refuse payment and wait for you to file a complaint against them. It's a fact. For people seriously ill, the cumbersome appeals process is often more than they can handle. As a result, hospital and doctor groups across the nation, and I'm bringing them to you regularly, are beginning to refuse to take Medicare Advantage patients. California-based Script Health, for example, this recently happened, cares for around 30,000 people on Medicare Advantage and recently notified all of them that Scripps will no longer offer medical services to them unless they pay out of pocket or revert back to real Medicare. Interesting, huh? 30,000 patients, but look at this. They made this decision because $75 million worth of services and procedures their physicians had recommended to those patients were turned down by Advantage insurance companies. $75 million and only 30,000 patients. In many cases, Scripps had already provided the care because they needed it in a timely fashion. Now they're stuck with the bills that the Advantage companies refuse to pay. Scripps CEO said, "We are a patient care organization, not a patient denial organization. And in many ways, the model of managed care has always been about denying or delaying care, at least economically. That is why denials, prior authorization requirements, and administrative processes have become a very big issue for physicians and hospitals." Similarly, it's almost done here, the Mayo Clinic has warned its customers in Florida and Arizona that they won't accept Medicare Advantage anymore either. Increasing numbers of physicians groups and hospitals are simply being ripped off by Advantage insurance companies. Not only is the Advantage scam a screw job for health providers, his words, and people who are on the programs are unfortunate enough to get sick, it also is preventing Americans from getting expanded benefits from real Medicare. And he talks about the $84 billion that would have gone through to regular people if not been overpaying to Medicare Advantage, and how that could have funded dental, vision, hearing for everybody. It's a dang shame. Here's some more information for you. If you did not listen to my prior video talking about the annual notice of change, please listen to this part. If you're on a Medicare supplement plan, there is no annual notice of change. Some people called in and said, I'm on Mutual of Omaha Medicare supplement or Cigna or Aetna's Medicare supplement, and I did not get my annual notice of change. Here's why. There is no annual notice of change because there is no change with a Medicare supplement plan. That plan that he was talking about, where you can go to almost any doctor in the country as long as they accept Medicare, and it's just paid, there's no annual notice of change because nothing is changing on those plans. You don't need to call us or call anybody during the Medicare annual enrollment period because there's no enrollment to be had. You don't need to change anything. Your benefits don't change on a supplement. What they do change on is your Part D drug plan, because that's a small part of Medicare Advantage world. If you're on a Medicare Advantage plan or a Part D drug plan, you definitely need to look at the annual notice of change. And now you can make changes with those from October 15th through December 7th. Whatever you choose between October 15th and December 7th for your Medicare Advantage or Part D drug plan then takes effect on January of the next year. Here's how that works. During the annual election period, it's not really open at all, but you can join, drop, or switch to another Medicare Advantage plan. Whatever you choose goes into effect January of the next year. Again, you have until midnight on my birthday, which is Pearl Harbor Day, which is the end of the AEP season, to join, drop, or switch to a Medicare Advantage plan. You can switch from original Medicare to a Medicare Advantage plan. Let me jump in here real quick. We've got thousands of clients in 47 states across the United States of America. We write business in almost every state, and we know all the players there. Many of you have been with me for up to 26 years as I've been helping people with insurance. If you've been on a Medicare supplement plan and you just can no longer afford the premium, and due to health reasons in the state where you live, we're not able to shop you into a better costing plan because these plans do change with their rates. They go up. And we like to get with everybody that we've written in the past. And when it comes time for their renewal period, see if we can save them money for the next year. And we can change Medicare supplements all year long, as long as your health allows you to change in the states that require it, which is the vast majority. So if you can no longer afford your supplement and you can't change to a cheaper one, this may be the time that you want to look at Medicare Advantage in the marketplace. And that's what we can help you with. So if that's the point of time for you, we have this small window that you can now do that, and you can reach out to us and we can help. We won't be calling you about Medicare Advantage. That's illegal. So you can switch from original Medicare to Medicare Advantage during this period if you want. You can join a drug plan if you're an original Medicare only. You can switch from one drug plan to another if you're an original Medicare only. You can either have only a drug plan or Medicare Advantage plan. You can't have one or the other all in separately. You're either going to have one or you're going to have the other. That's why Medicare Advantage plans will most commonly have a Part D. In the industry, we call it an MAPD plan, Medicare Advantage Part D, all rolled into one plan. The problem with that is you don't get to choose your formulary, your pharmacies, and all the rest based on your major medical component of that plan. You just get what they give you. It's all one wrapped in plan, which some agents promote that as a great thing instead of a customized thing. But then after December 7th, what happens, just for your educational purposes, I want you to know, then they have this other open enrollment period. This was an open enrollment. It's not really that. We call it the disenrollment period. And it's from January 1 to March 31. And during that period of time, in case we could not help you to get back to original Medicare or to switch what you want for your Medicare Advantage plan for the new year, you can do that again during the first quarter of every year now. Whatever change you make will go into effect the first of the next month. So you can switch to another Medicare Advantage plan if you happen to be on one and you didn't listen to me when I said, look at your annual notice of change. Big things happening. You better look at it every year. Just look at it. You can switch to another Medicare Advantage plan with or without drug coverage included with it. You can drop your Medicare Advantage plan and go back to original Medicare. There's a very important video on my website, SeniorSavingsNetwork.org, that goes through this process. You don't want to just drop your Medicare Advantage plan. During the annual election period, or during the disenrollment period. Don't just drop your Medicare Advantage plan thinking you're just going to jump onto a Medicare supplement and go back to original Medicare. You better get approved through underwriting first. And that's what we help you with, all that timing, so you don't get that wrong and end up in the next year with no coverage whatsoever. You can look at all this at Medicare. This is from the Medicare and You Guidebook. If you've not yet picked up your 2024 Medicare and You Guidebook, reach out to Medicare and they can get that for you, or you can download a PDF version of it on medicare.gov. This scan right here is where you can reach out to us. This will take you to the page where it asks you, what are you trying to do? And it'll guide you with a video on what you need to do to accomplish the goal that you're trying to reach. Then you can pick a date and time to get on our calendar. That is so far better than just calling an 800 number and getting in the queue, which as of today, we're 300 people behind on calling back, but we have calendar space open. We don't have enough people. We'd have to have 500 agents in here to answer every call in real time and then write their business if they need it. We don't have that. And we have this finite period of time of 54 days to help everybody that wants to get on or off or switch a Medicare Advantage plan. There's too many people out there, over 60 million people on Medicare, all getting an email from Medicare saying, you have to do something right now. You have to do something right now. Well, if you're talking about Medicare Advantage, that's true. So we can't help everybody. This will help narrow down what it is you need and jump onto a calendar with a licensed agent in your state that can help you and they know what they're talking about. If you ever want to help us out, please like this video. Make sure you subscribe, show up for more videos so you can keep up to date what's happening with Medicare. But one other thing is, if you go to Google, our friend Google there, and you type in on Google, Senior Savings Network, not the website, just 3 different words, Senior Savings Network. You type it in like that and hit enter. And then you click on our Google listing there. That'll help us a lot. It helps us in the search engines because Google will know that you look for us and you found us. And if you want to leave a 5-star review like so many have in the past, we'd really appreciate that. So in recap, there are 2 different ways to go with Medicare. Now's the season where you get to choose those ways for the next year. With Medicare Advantage, you can change plans. You can drop it all together, but don't do that, please, unless you've been approved from underwriting if you want a supplement for the new year, and we can help you with that. 2 different ways to go. The road less traveled, which has freedom and flexibility to go anywhere, or Medicare Advantage. There's one more thing I need to share with you. Consumer advocate out there, Clark Howard, had this to say this week about Medicare Advantage, and this is pretty amazing.
Think stinks, potentially stinks, Medicare Advantage plans. And as it turns out, a lot of people who thought they were making a good choice later burns them really badly. I'm going to tell you what you need to know if you, a friend or family member, are approaching 65, where you have to make a key choice for your health care from the government moving forward. The overwhelming number of people who go into an Advantage plan tell pollsters they're happy. I saw an item recently in Kiplinger that 70% of Advantage plan members are glad they went into it. Okay, but I want you to think about that. 30% of people being in something that could be life and death regret the decision they made and they can't get out? I mean, be fine with Medicare Advantage if you could bolt on them, but that requires states, of which only a handful have, the right for you to get out and go into somebody else, regardless of pre-existing condition. But see, the trap that these Advantage plans set in most states that you can't get around is that once you're in, you're stuck because nobody else is going to take you as you age, because you may have this wrong with you, that wrong with you, other wrong with you. With traditional Medicare, you choose who you see, what care you get, and the rest. You go into an Advantage plan, they tell you who you can see, when they're going to cover this, when they're going to cover that. And the worst is if you end up with a really bad disease, let's say a form of cancer, and they don't have any facility or oncologists in the plan that are considered to be good or cutting edge or whatever. If you want to go get good care, you got to pay out of pocket, which you may not be able to afford to do. Advantage plans should be portable. You should not have to worry about this loophole where most states have not done anything about this, that you are permanently imprisoned in what could seem up front to be a good plan and later turns out to be garbage. Garbage that could cost you your life. So I understand why people are pulled in, lured in to the Advantage plan, because then many times you're not having to pay monthly fees like people go into regular Medicare, which is roughly, I think, 50-60% of people are in regular Medicare. Because then you've got to buy what's known as a Medigap policy, which you're having to pay a monthly premium for that covers expenses that Medicare itself doesn't pay for. Medigap plans aren't cheap, but you retain your freedom. So if something did go wrong with you and you needed to see or wanted to see this specialist or go to this hospital or this cutting-edge cancer center or whatever, you're able to make that choice. But if you're in an Advantage plan, you can't. And so for these reasons, that's why I call them disadvantage plans. But have something that could be life and death, and 30% of people wish they weren't in it, that's a problem.
That is a problem. The more you know, the more equipped you'll be to make a right decision for you and everyone that you know that's on Medicare. We work 100% from referrals and people calling us. If we can't get back to you right away, I apologize. We're doing the very, very best we can. That's why I say, please use the tools at the website on the Medicare help part. Let me put that up there again. If you go right here, it will ask you what it is that you're looking for. And you can just go right to it, and that will help a lot. That way you can save time. Maybe you can get the answer as to how it works to go from Medicare Advantage or not. And just getting the answer is maybe all you needed right now. And that's available right there on the website. So I encourage you, go to that page and click on what it is that you need, and then get on our calendar with a licensed trained person that works in my office in here so we can help you find what it is that you need. It's going to be a very, very busy, very, very taxing, and very, very stressful time for everyone that's in my office. It always is. We have a limited number of 54 days where Medicare is telling everybody under the sun to call, and we can't help everybody under the sun. We can only help those people that we can help. Again, if you're on a Medicare supplement, please stand tight. Just keep your Medicare supplement through the season, because your benefits are not changing now or anytime. And we can put you on another Medicare supplement. We can shop the rates for you. We can change you to a different plan anytime during the year. In California, they've got the birthday rule. That means you can change without underwriting anytime around your birthday, 30 days. Oregon, same thing. Washington State can change anytime to another Medicare supplement. There's no reason to do it at this time of the year when everybody else is trying to change all their Medicare Advantage plans. New York State, you can change any time of the year. You don't need to do anything right now. Missouri has the anniversary rule where you can change at your policy anniversary without any underwriting whatsoever. Illinois has a similar law. Maryland just got another law that's guarantee issue. So we know what these laws are. We know that the companies are. I'm just telling you, this is the worst time to call everybody about a Medicare supplement plan if you've already got one, because your benefit's not going to change. We can write you for one to change to another one. It's just that this is the finite period of time that has to do with only Medicare Advantage. Look at the updates on our website. It's at the top. When it pops up when you go to our website, see all the updates for 2024. Answer your question about drug plans and how to find one for 2024. Very simple process. I'm Chris Westphal. Very tired after a very long day. God bless you, and thanks for watching. We'll talk to you soon.